I'm here with Tracey Alderson at Unisus, and I'm going to ask Tracey a few questions about her job here. So, Tracey, how long have you worked at Unisus?
Worked for Unisus for about 3 months now.
Okay, and what is it you do?
General care, so personal care, helping people get up in the mornings, making sure they take their meds, helping them get a good decent meal down them, assisting them back to bed on night time. Sometimes you work on a single call, sometimes you work on a double up call.
What does that mean?
So if it's a single call, there's only you and the client, and obviously they're not as difficult to do. Usually if it's a double up call, it requires a lot more moving and handling, so it could be anything to do with hoists, stand aids and so forth.
Okay, and what do you think is the most challenging thing about your job?
Possibly when you get a client that can be sort of agitated, so if they've got dementia for instance, you know, they can become a bit confused and unaware, and they can maybe sometimes lash out a little bit. So it's just being aware of their good days and their bad days, and knowing how to control that and how to try and settle their bad days. That's probably the most challenging part of my job.
Right. Okay. So you've just been telling me about the challenging part of your job. What on the other side of the coin, what do you think is the most rewarding aspect of your job?
When you get on really well with the clients to the point that they're having a laugh and joke on with you, and it makes them feel more settled at home, makes them feel settled about having carers come into their house, and they don't feel nervous, and they kind of see you more as friends as opposed to like just somebody there to help, even though that is what we're there to do, we're there to help, but they feel that you're more friendly with them. And it's rewarding to know that when you've left the house, the client's happy because you've made them happy, because you've had a laugh, you've had a joke on, you've had a carry on, but you've made their day better because you've done their personal care and you've helped them get ready and made them comfortable for the day, and they've had a decent meal down them, and yeah, it's really rewarding.
Excellent. Okay, and the final question, Tracey, is what do you think makes Unisus different to other care companies that you've worked for?
Unisus is really caring job, like company. They think about the clients, but they also think about the carers. No issue is pushed under the rug. It's always dealt with there and then, and if you need to change anything, your availability, for instance, for whatever reason, you've got another job on the go, or you know, you've got family issues, it's done straight away. There's nothing to question it, there's nothing to say no, you need to stay and work the rest of the day. They instantly sort it out so that you are free to go and do what you need to do, and they're just so friendly. You're always welcome in the office for a coffee, even if you've just got an hour break. You don't have to be scared to come in, you don't have to be scared to ring anybody if you've got a problem, and I think that makes it much more of a better company, because you don't feel scared, you're able to just open up. It's like one big family, like everyone groups together and it becomes one big family. You can all rely on each other, and you can come in and everyone's smiling, happy to see you. You know, everyone's like, oh, help yourself, make yourself a drink, and if you just want to come in just to let off some steam with the manager, Claire, she's brilliant. You can just come in and sit with her and tell her what the issues are, what your problems are, and she just makes you feel a lot better about it before you go back out to work. And I just think it's the best company that I've worked for.
Great.
I feel really happy here.
I'm delighted to hear it. Well, thank you very much for talking to me, Tracey.
Okay.